I'm 63 years old, married, 2 adult children. My wife and I both still work. I in commercial real estate services and she for the Amtrak Police Department. I'm also the trustee for my parents' family trust. I have 13 siblings, so that can make it a little complicated from time to time. I grew up in the area, attended the University of Maryland in College Park. I've been a vegetarian since my early 20s when I was a runner and an athlete, although I do eat fish and seafood on occasion. Always had an active lifestyle, professionally and personally, and I was diagnosed in August of 2015 with squamous cell carcinoma at the base of my tongue. The thing that strikes me the most is the almost complete lack of symptoms. I had a little puffiness in my neck, and I thought, well, maybe that's just swollen glands from seasonal allergies, which I'm susceptible to. And I went to my personal physician. He said, I don't like that one bit. Go see these guys. And that's what started the whole process. I didn't have any trouble swallowing. Maybe I was a little more tired than I normally am. Needed more sleep, but that's it as far as the symptoms go. Well, I thought about my family, mostly. I'm not a real reactionary person. I always take my time. I was diagnosed in August. It was October when I had my surgery. I always do my homework. That's kind of what I do for a living. I investigate things. I don't have the answers. I have the questions, and I go find out what the answers to the questions are. So I was nervous, but I wouldn't say I had a lot of fear, because it is what it is. You're going to get cured, or you're not, or you're going to have treatment, and it's going to affect your life, or it's not. You just do the best you can going into it. One of the things that surprised me, I guess, was pre-op was meeting with the team at Johns Hopkins. I loved that team approach. We went in one day, my wife and I, and had studied all the materials we had up to that point, and they had everybody there who might be treating me over the coming years, and they answered every question we possibly had. And so that was actually kind of surprising. Like I said, I didn't have any problem swallowing even shortly after the surgery. There was something I remember just now when we went back after 10 days to talk to the doctors about the results and get the good news, which ended up being good news. One of the nurses there said, here, try this. It was a little over-the-counter spray. Because what I was concerned about was with pills. I was a little bit reticent to swallow any pills. I had liquid painkiller at the time, but there were some other pills I was needing to take. And it was like a super glide. Sprayed on the back of your throat, and it just psychologically gave you the courage to go ahead and swallow that solid thing for the first time. I think that was really worthwhile. And if you want, I could find the name of it. But again, it was just an over-the-counter, somebody invented it. It might be called Pill Glide for all I know. I didn't feel totally incapacitated. One of the questions I asked was, before surgery was, when will I be ambulatory? That wasn't communicated. I had to ask that. And my surgeon said, if you're steady on your feet, you can walk around the next day. Makes a big difference. Maybe you don't have to be catheterized. Maybe you can get up, walk around a little bit. So that was that was pretty important to know that. Just cautious with the painkillers, which I term myself a drug wimp, so I don't do a lot of painkillers. But with the painkillers I had after surgery, I didn't have any problem swallowing liquids or semi-solids. And I was eating soft foods in fairly short order. That reminds me of another surprise post-surgery was I came out with a drain in my neck, which didn't matter to me, but my wife just couldn't change the little bag they gave you. She just couldn't do it. Yeah. So luckily, I was ambulatory and able to do it myself. She tried really hard the first time to get it done, but she just a little squeamish about that kind of stuff. It was just, literally, it was days. Okay. I do a lot of teleworking, do a lot of consulting, so once I was clear-headed enough, I was back. Okay. But going out in the field, it was probably a couple of weeks. A couple of years. It was a couple of years. What surprised me about post-op was my tongue, portions of my tongue were numb. Easily for over a year and a half, which was news to me. So things didn't taste the way I remembered them tasting. They didn't necessarily taste badly, and it wasn't that I was lacking that ability to tasting. They just didn't taste like what I remembered. So it affected my appetite. Great weight loss program. It's not worth the price you pay, but I probably dropped, I've never been heavy, but I probably dropped 15 pounds from just not eating much. A little bit in the neck. I actually went for some lymphedema therapy, and at that time, it was 2 or 3 sessions. Okay. They taught me how to do some massage, but they also taught me neck stretching exercises, because I would get a little jolt once in a while for 6 months after my surgery. But that's pretty much calmed down, and so the therapy worked pretty well. The surgical aspect of it, because from my understanding, the standard of care at that point in time was we go straight to radiation and then chemo. And my understanding of or at least that was the standard at my first stop at Anne Arundel Medical Center. And my understanding was that, well, in this study, what they're trying to establish is maybe we're over-radiating patients, and we're going to do the surgery first, and if you need radiation, they flip a coin, metaphorically, and you either get the lower or the standard amount of radiation, and then you go to chemo or not from there. And any opportunity not to have radiation and chemo was good in my book. And Hopkins, I believe, at the time, was the one in my geographic area that was doing it. This all came back. Like I said, my throat feels fine. After the first follow-up, we established a pattern where, okay, I'm going to come in, we're going to do labs, we're going to do the blood work, swallow study, CT scan. Much more stressful for her than I. Not just because of her personality, but again, because I'm the patient. I think the caregivers have a much more highly stressful role in the whole process.
I agree.
Once we were given the word, which was again, I think it was only 10 days later when we went in after surgery. And they gave us the word. She just broke down in tears and saw our coordinator, took her outside to calm down, and I finished the interview with the surgeons. But she's a trooper. I mean, as far as pushing herself past her comfort level, she's a superstar. I would just say, and this is just my personal philosophy, is stay inquisitive from the time you find your diagnosis. Don't stop asking questions. I think too many people on the patient side say, well, you know, I don't want to bother the doctor with that, or they're the doctors, they know best. Well, as you guys know, it's not a black and white question all the time. There are different methodologies, and keep asking the questions until you feel as comfortable as you think you can be. Well, I think that the most important thing for you as a patient is if you can't be your own advocate for one reason or another, spend the time to communicate with whoever is going to be your advocate. I'm not talking about the medical side coordinator, but your personal representative, and make sure that they are both willing and able to take charge.